Good afternoon, everybody. I am Hasna Irzan, a PhD student at the University College London. I am going to talk about our results on analyzing the white matter connectivity of a cohort of 19-year-old individuals who were born extremely preterm. Specifically, we identified hub regions for extremely preterm individuals and compared them to age-matched control group. So first of all, let's define where the extreme preterm birth lies with respect to normal birth. The birth timeline is described by weeks of gestation. A birth after 37 weeks of gestation is normal birth or full-term birth. However, usually a full-term birth is around 40 weeks of gestation. Birth happening between 32 and 37 weeks of gestation is preterm birth. Babies born between 27 and 32 weeks of gestation are very preterm born. Birth at less than 27 weeks of gestation are called extremely preterm. Why we care about preterm births? A key factors overview. In 2010, the World Health Organization estimated that more than 10% of babies are born preterm, and that globally prematurity is the leading cause of death in children under the age of 5 years. In developed countries, better socioeconomic factors and improved neonatal care have strengthened the ability to treat babies born at immature gestational ages. A 2012 UK study comparing preterm birth between 1995 and 2006 found that increased survival rate after preterm birth in the UK has not been associated with a substantial decrease in neonatal morbidity and the prevalence of poor cognitive performance. This is of great concern since the increasing number of survivors are facing lifetime disabilities, and obviously this presents costs for society, healthcare systems, and education. Identifying the extent to which the preterm brain is altered and which brain areas or brain networks are most compromised is crucial to plan personalized treatments and targeted therapies at an early stage. In the literature, studies have reported not only that white matter abnormalities are the most common brain anomalies, but that white matter abnormality might be the underlying cause of gray matter loss. By using diffusion-weighted MRI acquisitions, white matter bundles can be studied as a network of all possible pairwise connections between brain regions. In this network, the nodes are the brain regions, while the edges quantify interconnectivity between the nodes. There are very special nodes in the brain network called hubs. Hubs are highly connected brain regions with a crucial role for the information transfer in the network. Because of their role as focal points for information transfer in the network, any dysfunction of hub regions may have a disproportionate effect on integrity of the remaining network. Different brain regions are defined as either hubs or non-hubs depending on the specific centrality measure used. Literature proposed different centrality measures to identify hub regions. The most common centrality measures are node strength, nodal efficiency, and betweenness centrality. As clearly seen by its formula, the node strength quantifies the total strength of edges incident to a node. The node strength is shown here for the networking example where we assume that the edge strength Wij is 1. The nodal efficiency, on the other hand, is defined as the normalized sum of the reciprocal of the shortest path lengths from a given node to all other nodes in the network. Here we show the nodal efficiency values for the networking example. The betweenness centrality of a node is defined as the sum of the ratio of the shortest path between any pair of nodes J and H that passes through the node I, and the total number of the shortest path between nodes J and H. Here again, we show what would be the betweenness centrality for each node of our network example. Here we propose a definition of hubs based on consensus approach by combining rankings across centrality measures. We think of hubs regions as nodes with a high node strength, high nodal efficiency, and high betweenness centrality. Specifically here, each node is assigned a score of 1 each time the node is in the top 25% of nodes with strongest node strength, or the node is placed in the top 25% of nodes with the highest betweenness centrality, or the node is in top 25% of nodes with highest nodal efficiency. With a maximum of 3 scores, nodes that score 2 or higher are classified as hubs. This slide shows the putative hub regions identified for extremely preterm on the left and full-term born individuals on the right. The figure shows an overall agreement between the control group and the extremely preterm individuals. In addition, the identified putative regions are consistent with previous studies on healthy subjects by identifying bilateral caudate, bilateral thalamus, bilateral putamen, bilateral precuneus, bilateral superior frontal gyrus. Statistical analysis showed that node strength and nodal efficiency are statistically reduced in the identified hubs. So we investigated birth status or group, sex, and total brain regions as confounding factors of this variation. So we devised 4 nested GLA models where we compare the full model, the first model containing all the regressors here, to a set of restricted models, where Y in all the models represents the mean of the graph metric measure under analysis. So in one case it's the nodal efficiency, in the other case it's the node strength. The F-test analysis of nested GLM models revealed that brain volume and the group membership, meaning its model 3, are the most accurate to describe the variance node strength and nodal efficiency. So with respect to model number 3, the brain volume described 37% and 99.5% of the variance in node strength and nodal efficiency respectively. The group membership, on the other hand, account for 12% of the variance in the node strength and 4.4% of the variance in nodal efficiency. So overall, the analysis revealed that although the extremely preterm and controlled subjects have comparable hub network, the hubs in the extremely preterm group have a statistically significant reduced connectivity and nodal efficiency. In addition, observed differences in connectivity might be due to volume change as well as extreme preterm birth. Thank you.